This is a plain CT scan brain of a 1-year-old male baby who presented with delayed developmental milestones. Now we start from the posterior cranial fossa. Cisterna magna is dilated. Fourth ventricle is dilated. Both cerebellar hemispheres are relatively smaller in size. These are splayed apart. Now this is the vermis, which is also smaller in size. Low down, fourth ventricle is communicating with the dilated cisterna magna. There is no enlargement of posterior cranial fossa. So this is a Dandy-Walker variant and not a Dandy-Walker malformation. In Dandy-Walker malformation, there is enlargement of the posterior cranial fossa and tentorium cerebelli is pushed upwards. Now, please observe that there is moderate to severe hydrocephalus. Dilatation of right lateral ventricle is relatively more marked, and more so its temporal horn and the occipital horn. Third ventricle is also dilated. One thing that needs to be considered very carefully and documented and commented upon is that there is dilatation of the extracerebral CSF spaces. Now this is suggestive of mild cerebral atrophy. The patient is unable to hold his head. Please observe the dilatation of the sulci and thinning of the gyri. Now this is not part of the benign enlargement of subarachnoid space of infancy or benign external hydrocephalus. This is the mild cerebral atrophy. There is disproportionate dilatation of the both lateral ventricles and third ventricle. We have to mention this in the report, because if it is a communicating hydrocephalus, then VP shunting would benefit the patient. But in such cases, VP shunting will not benefit the patient because of the cerebral atrophy. This is the bone window. Considering the moderate to severe dilatations of the lateral ventricles and third ventricle, there should have been significant sutural diastasis. But since mild cerebral atrophy is there, so the sutural diastasis or the sutural prominence is just minimal. This is the sagittal scan. Now this is the aqueduct which is dilated. These are the colliculi here. This is fourth ventricle. Now this is the fourth ventricle which is communicating with the dilated cisterna magna. There is no enlargement of the posterior cranial fossa and tentorium is at its normal place. This is the coronal scan. Please observe disproportionate dilatations of the lateral ventricles. Right lateral ventricle is dilated more as compared to that of the left lateral ventricle.